Hi everyone, this is Dr. Susan Brown at the Center for Better Bones. I'm really glad to be again with you for another one of our Facebook live chats. We try to do these every Thursday, 12:30 Eastern Standard Time, to bring you the newest updated information on bone health. We also frequently discuss the material that I wrote about in the blog for that week. Like this week, our blog was on medications that cause fracture, medicines that can actually damage your bone, and what you might do about that. If you pick up this session, this video, if you've missed part of it, don't worry. These are posted on Facebook and they're posted on our website, our YouTube site, which is Dr. Susan Brown. Is that right? Dr. Susan Brown is our YouTube. We have hundreds of YouTubes. Check them out. You'll find lots of valuable information. So today we're talking about medications and fracture. This is the illustration that was in our blog. You might have a hard time reading it, but the three major medications we're talking about, the three ones, are steroids, corticosteroids, antacids, in particular the proton pump inhibitors, and antidepressants, the serotonin uptake inhibitors. We're going to review those three classes of drugs that are very popular drugs used by large percentages of the population, and each of those type of drugs has very specific detrimental effects on bone. So let's review these and give you some tips what you might do if you're using these drugs, what you might think about. So the steroids. I'm particularly interested in steroids because it has long been documented that up to 20% of all osteoporosis in this country is caused by the use of steroid drugs. Steroid drugs like prednisone directly damage bone. They increase bone breakdown, they halt bone buildup by many actions, and in fact, they bring about a very rapid bone loss. This bone loss can be as high as 20% of your total bone mass within just the first year. And of course, the longer you use these drugs, the higher the dose, the more of the problem. And not only do steroids cause rapid bone loss, but they also increase fracture risk. And in fact, the fracture risk data is very interesting. The increased risk of fracture is from 30 to 50% increased risk of fracture in the first 6 months. And if you continue longer, you have greater risk. And in fact, researchers have suggested that probably half the people on long-term steroids actually experience an osteoporotic fracture, a very serious cause of bone weakening. And the interesting thing about this is even low-dose steroids can do damage. An advocacy group in New Zealand has estimated that even 2.5 to 5 milligrams is enough. 2.5 to 5 milligrams of prednisone is enough to begin damaging bone and increasing fracture risk. And in the U.S., it's commonly said that 7.5 milligrams can damage bone, so very low dose can damage bone. And even the inhaled steroids can be a problem. So we need to pay a lot of attention to that. You might say, well, I'm using steroids, what should I do? Well, the first thing is to make sure you really need the steroid medication. Many times here at the Center for Better Bones, we see people who are taking steroids for allergy. They're congested, they've got a little sinus, they're getting infections. It's not a good idea. You want to avoid use whenever possible, and more particularly go to the root cause of the problem. If you have an allergy situation, find out the cause of that allergies, work to correct that allergies. Every day, we and progressive medical practitioners all over the country, functional doctors, nutritionists, chiropractors, naturopaths, homeopaths, help people get to the cause of the problem. Like, for example, allergy is a cause for which many people use the steroids. Asthma is another common case, and whenever we see asthma, we certainly think allergy. So if you take the effort to say, what is the root of this problem? Why do I have this inflammation? Why do I have this pain? Many times steroids are the root of the problem is autoimmune disease, whether it be rheumatoid arthritis or lupus or multiple sclerosis. The immune system becomes activated. We use these drugs, this prednisone, to quiet down the immune system. but it has so many negative effects on the body at large that you want to be sure to see if you can limit your exposure, and you'd like to get to the cause of the problem. For example, now there's some excellent programs for autoimmune disease, programs that actually identify which foods and chemicals are troubling the immune system, identify the many nutrients you can take to build gut integrity, because autoimmunity is always related to proteins leaking through the gut, getting into the bloodstream and sort of overwhelming those white blood cells. We're in a new age now. When I started maybe 20 years ago, 30 years ago, there was very little you could do for autoimmune disease except to try to suppress the symptom. Now, you'll find many progressive programs. My favorite one, of course, is the program by my mentor, Dr. Russell Jaffe, who has developed a very elegant test called the ELISA-AC test, which can test for hundreds of foods and chemicals to see what is causing those white blood cells to become activated, to turn into Pac-Man, to provide a foundation for autoimmune disease. And that test can test not only immediate reactions, but delayed reactions. We'll one day talk about allergy and immune response because it's so very important. The idea here, however, is if you're having an inflammatory response, if your doctor says you should use steroids, take the time to explore that disorder you have and see if you can get closer to understanding the cause of it and correcting the cause. If you have to use steroids, use the lowest dose for the shortest possible period of time. We do find that if you take certain nutrients like vitamin C, especially some very potent forms of vitamin C, quercetin, like water-soluble quercetin, it can help spare steroids in the body so you can actually use your own steroids and not have to be taking so much of the prednisone. And if you end up using steroids, pay special attention to getting all of the 20 key bone nutrients. You know, here at the Center for Better Bones, for years we've talked about the fact that it's not just calcium, it's not just vitamin D, it's not just magnesium even. There's at least 20 nutrients that are essential for bone health. And we have a lot of information on that on our website, betterbones.com, but get all those nutrients. You'll find the physicians hopefully have already tested you for vitamin D because vitamin D is absolutely essential. You want to get adequate vitamin D, and we're always striving for a 50 to 60 Ng level to protect the bones while you're using the steroids. You want to use calcium, but you also want to use manganese, zinc, copper. Like the Better Bones Builder product I developed has all those nutrients in it. And there are many protocols given on our website where you want to achieve all these nutrients to protect bone while you're using a drug that actually damages bone. The new frontier in steroids is really the question of antioxidants. What they're discovering now is that one of the ways that the steroids damage bone, which was sort of unexpected, is that they produce a free radical damage in the osteoblast. The osteoblast is that little bone-building cell that spins out collagen and then minerals are deposited on that. That's the major bone-building cell. That is the bone-building cell. And it experiences oxidative damage when you take steroids. So the new frontier is using antioxidants. We, of course, like special buffered vitamin C. The researchers are using alpha lipoic acid. And I'm going to suspect that even curcumin is going to be helpful there, as well as vitamin E, resveratrol, many other potent antioxidants. So get adequate antioxidants. And of course, one way to get those is to have a really alkaline diet. Lots of vegetables, lots of fruits, colorful foods, foods of every color, nuts and seeds. If you haven't yet moved away from processed foods and high sugar foods, move into a diet with nice 2 cups of vegetables for lunch and dinner, maybe a serving of beans a day, a couple serving of nuts and seeds. Herbs and spices are very anti-inflammatory. Stoke up the diet to have an alkaline diet. This is so important for bone health that here at the Center for Better Bones, we've produced a pH test kit, which will have all the information you need on how to alkalize. It'll have sample menus. It'll even have the book that I wrote on pH balance, a book that's been translated into many languages because people all over the world know that if our chemistry is in the ideal state, we can preserve bone, we can preserve muscle, our immune system functions better. So many things function better if we alkalize. If you take steroids, be sure to alkalize. Exercise is always important for bone, and the research is showing that even if you have the burden of steroids, if you exercise, you're going to limit the negative effects of the steroids. And of course, you want to avoid the bone depleters, the classic bone depleters like smoking, excessive alcohol, excessive sugar, processed food. And you even want to limit stress. More and more, we're seeing that stress, thoughts held in the mind, our response to stress is very damaging to bone. So those are some of the things to think about if you have to use steroids. Let's look at the next drug that damages bone. And this is, again, a fascinating and sort of overwhelming story. These are the proton pump inhibitors called PTI. And these are things like Nexium, Prilosec, Prevacid. These are very popular anti-acid drugs that many times are used even without proper indication. In fact, I saw a recent study where they looked at hospital population, the people that came in, 30% of those, up to 30 to 50% of those on proton pump inhibitors really didn't have a good reason to be using them. And you're going to see why you want to be very careful with the proton pump inhibitors. The first step is they increase fracture. And the studies show that from 30 to 50, even 200% increased risk of fracture using these common antacids that people might pop, oh, because I have heartburn or I have a little reflux or I'm feeling a little indigestion. Again, instead of going to the cause of the heartburn, instead of looking at the food reactions, instead of changing their diet, people take these drugs and they have many pernicious impacts. So you have an increase in fracture. Even as striking, and for many of you, maybe even more striking, is an increase in kidney disease. Whether you know it or not, kidneys are extremely important organs for bone health. They actually control the amount of minerals that stay in the body, go out of the body. And as Chinese medicine tells us, the kidneys control your life energy. Kidney damage is a very serious thing. And up to 50% of the people using these drugs over the long term develop some degree of kidney failure. It's bad enough that as we age and as we eat the typical American acid diet, our kidneys weaken. But you throw on top of this a drug that actually can directly damage the kidneys, and you in much more serious problem. So if you want to live a long life, if you want to have healthy bones and a healthy body as a whole, give a second thought to these proton pump inhibitors. Heart attacks are increased by 58% with long-term use. And the newest research is on dementia and Alzheimer's disease that's increased by 44%. Even GI infections, like your chance of developing C. difficile infection, is greatly increased. You know, it kind of reminds us that the body is such an amazing unit. We have billions of cells. Every cell does 1,000 things a second. It's a great field of intelligence and information. And when we start tinkering around with this field, we get untoward effects. Here at the Center for Better Bones, we always try to work with nature to regain function. When it comes to digestion, we have a very nice little series of tips called 10 Steps to Stronger Digestion. I think we're going to post you the link here. You might start out with those simple steps. You might start experimenting with your diet. There's many wonderful books on this, like Marty Whittaker is a nutritionist colleague of mine who I've interviewed. We have an interview with her on our YouTube channel. Many ways you can correct indigestion without taking these drugs. There is an interesting point here that other acid blockers, like the H2 receptor blockers, like Tagamet and Zantac, they don't seem to have the same effect on bone. Researchers haven't been able to point that out. So I guess you could say if you have to use those, if you want to use a drug antacid, those would be better. We, however, use many natural approaches, and you'll find many of these discussions online, like deglycerized licorice, changing your diet, testing for food allergies, many things you can do to get your digestion back in order. And it's so important because when we look at bone health, vast majority of people, or many people with poor bone health, actually have digestive problems. And doesn't that make sense? if we don't digest the nutrients well, if we don't assimilate all the nutrients, we aren't going to have the factors we need to build strong muscles, strong bones, strong brain, strong body as a whole. Digestion, the old timers would say, is the hub of our energy force. So pay attention to it. Build digestive strength. The way to start is looking at our 10 steps to stronger digestion, just paying a little bit of attention to that. So the proton pump inhibitors, bad news for bone. The other drug, now I have to say there's many drugs that are bad news for bone, but I picked out the 3 classes that are well known to damage bone and that are very popular, just commonly used without kind of a second thought of what is the use of this drug going to mean for bone. The third category of drugs are these antidepressants, particularly the serotonin uptake inhibitors, which are directly known to increase the risk of fracture. And these are drugs like Prozac, Celexa, these common drugs that so many, not only mature people, but young people are given for anxiety, depression, many times for other disorders like maybe mood swings or hot flashes. When it comes to drug therapy, I'd say there's no free lunch. So be really careful, because it would be far better to go to the root of that problem, whether it's anxiety, depression, whatever, and try to solve it. When you use these serotonin uptake inhibitors, what they do is they reduce the exposure to serotonin. They keep the body from uptaking this neurotransmitter, which is serotonin. As it turns out, serotonin is very important to bone health. And in fact, there's receptors on the osteoblast, remember those bone building cells, and there's receptors on the osteocytes, which are cells that are buried deep within bone and send all kinds of signals around bone of how to grow and where to repair bone. There's receptors for serotonin. Serotonin is very important to bone, and we don't understand all the ways serotonin is important to bone, but what we do know is that when you use these serotonin uptake inhibitor drugs, you see an increase in fracture. So we're talking Prozac, Zoloft, Paxil, Celexa. And what you find is that if you already have osteoporosis, you have a 300-fold increased risk of fracture if you use these drugs for any substantial amount of time. And if you have a tendency to fall, you have a 600% increased risk of fracture. And it makes sense, because on top of their biochemical action on the bone cells, these drugs also increase the tendency to fall. And we know that anything that increases our risk of falling is going to increase the risk of fracture. The vast majority of fractures occur because of falls. So pay attention to these serotonin uptake inhibitors. And in fact, they did an interesting study. They looked at these serotonin uptake inhibitors like Prozac and Zoloft and Paxil, and they said, let's compare the women using these to the women using antacids. And they took the 2 bunches of antacids, the proton pump inhibitors, which directly increase fracture, and the H2 blockers, which don't seem to increase fracture, and putting those 2 groups together, those antacids, they compared them to the people using these antidepressants. And as it turned out, the women using those antidepressants had a much higher fracture rate than those using the antacids. Now, I remind you, there was a mix of the bad antacids and the better antacids, so it's a little confusing. But still, after 1 year, the women on these antidepressants had a 76% higher rate of fracture than the people using the antacid drugs. And even longer, after 5 years later, there was still a 67% increased risk of fracture. So again, I would take some time to see, do I really need this medication? What else can I do? There's some wonderful books. We're getting in a whole new age where a lot of the medical information, the progressive medical information, is being available. And there's a wonderful book called The Upward Spiral, which really deals with depression and some very scientific self-help things you can do. So I would pay attention to all of that. Serotonin uptake inhibitors, not a good thing for bone. So when we think about our final thoughts on these drugs that cause osteoporosis, these 3 major classes, well, there are many other drugs that really contribute to bone loss, But it's pretty simple. We say go to the root. Find out the cause of the problem. I mean, I always joke, we're going to have a choice. There's better living through chemistry, where you can say, I'm going to take a pill for every ill. Or you can say, I have an amazing respect for the order and intelligence of the human body. So let's see how I can regain natural functioning, how I can get the body back into its natural balance. We suggest go to the root of the problem. If you have to use a drug, try to choose the drug that is bone safe, that has less of a chance of damaging bone. And always, if you have to use a drug that will damage bone, do the lowest dose and the shortest period possible. And hopefully you'll be working on your natural remedies to get at the root of the problem. Finally, remember, you should always, even if you are using these drugs or you have to use these drugs, you should nourish and protect bone while you're doing the drug. And you should do it always, actually. So we're talking about getting all the 20 key nutrients, alkalizing, doing appropriate exercise, paying attention to stress and hormonal balance, because more and more we're seeing how stress has a big impact on the body. Like my friend Deepak Chopra says, nothing holds more power over the body than thoughts held in the mind. So let's see how we're responding to stress, how we can quiet that down, how we can become more peaceful. So I hope these tips will be helpful. We have a couple questions here. Let's see if we can answer them. How are we doing for time? Yeah, we got a few minutes. We'll answer these questions here. I can hear perfectly fine. Oh, so someone's mentioning about the sound. I hope the sound is okay on that, that you can hear it okay. We're doing our best. Let us know if you don't hear it okay. We'll adjust that. Some people want to know, so this is very informative. I must take prednisone for a rare disorder for a long time. And this person suggests that this information is helpful. If you have to take prednisone, then pay attention to these guidelines and also think about those nutrients such as the antioxidants, the vitamin C. There's actually nutrients that spare steroids. Think about boosting up your diet. Be sure to get the exercise. That's very wise. And that's a very good point, Vera, because some people do have life-threatening situations or very essential situations that they have to take these, for example, steroids for autoimmunity or serious disorder. You'll find that there's many doctors now that are really being aware of factors that rebuild health, like these functional medicine doctors, nutritionists, homeopaths. So hopefully over time, we can limit our exposure to these drugs. But that's a really good question. And always remember, the simplest of all the things is vitamin D. If you haven't had your vitamin D, get it tested. Make sure the vitamin D is adequate, because that regulates so many processes of the immune system, and it's directly related to issues of autoimmune disease. Also pay attention to alkalizing. Vera and you and others, try to alkalize your diet. It'll be really very important to set that chemical situation where the body can heal itself better. Great. Well, it's been fun talking with you. I just have one question from last week that I'd like to answer too, because we have like a minute or so more. This is, hi, can you help me understand why there is a big difference between your list, my list of alkaline on other sites? This question is a good question. pH balance is a whole new topic, and it's only understood by a few physicians, although on the betterbones.com website, we have a database, if you search for it, of studies, hundreds of studies that talk about pH balance and its importance in bone health. People are just beginning to figure out, if you eat this food, what's the effect? Is it going to leave an acid residue? Is it going to leave an acid residue? Like, will it produce acid after it's metabolized? Which means, will it produce free hydrogen? Or will it produce a base, like a bicarbonate? And so it's sometimes confusing. Some people say, well, I go by the taste. Some of the tables talk about the taste of the food. They say this food tastes acid, so it must be an acid food. They don't calculate how it's metabolized. Other tables come from researchers who calculate how it's metabolized, but they have a different way of calculating it. the most important thing is that really the tables are very, very similar as a whole. Most fruits, vegetables, nuts, and seeds alkalize. Now, you might have someone that says tomatoes, we say tomatoes are acid forming, another might say they're alkalizing. That has to do with the calculation. And how we calculate it is based on some of the major research and discussed in our book, betterbones.com. It's discussed on the website, betterbones.com, and in our book, The Acid Alkaline Food Guide. But I would look, we always say there's just slight variation in those tables if the tables actually calculate the metabolic effect. And I would pay attention to my own pH. You can test it yourself. See what your first morning urine says. Like we say lentils are alkalizing. So you experiment. You say, gee, I'm eating a lot of lentils. Is it helping my pH? We say tomatoes are acid forming. You can experiment yourself. Finally, don't take that too seriously because we need both acid forming foods, especially the proteins, and we need alkaline forming foods. We just want to tip the scale towards more alkaline forming foods. And the most important thing is your first morning urine, so you can adjust that yourself. And remember, the final tip is that first morning urine reflects your mineral status. If you have a good alkaline status, if your pH is between 6.5 and 7.5, you likely have enough minerals. We'll talk more about that, and you can refer to my previous little video on the alkaline diet. Well, great. It's been fun being with you. Here at the Better Bones, the Center for Better Bones, we have the great privilege of working with students, interns, and volunteers from Syracuse University. Now, I'm going to have one of our volunteers who's been a great help this summer, Alyssa, step up and tell you what you should all do if you want more information on these topics.
So you should all go to betterbones.com or Alkaline for Life.
That's what we say. Thank you very much, Alyssa. I hope that you all have a great day, and we'll talk to you next week. And we'll talk to you next week.